Okay, students, we're going to continue on our conversation with substance use disorder, talking about cannabis use disorder. When I'm using that term cannabis, I am talking about marijuana. This is a drug that's derived from dried and ground up leaves and stems of the female hemp plant. Hashish is a form of marijuana. It is stronger, and it's produced by drying and utilizing the resin. Marijuana is the most frequently used illicit drug in the United States. About 19 million people reported using marijuana in 2012. We do know that more men than women use marijuana. About 12%, 11.8% of adult men did report using marijuana in the past month, as opposed to 6.6% of adult women. What's alarming to us is that the rates of daily use are on the rise. And we're not sure why this is happening. We're not sure why people who are users are escalating their use to engaging in smoking more frequently. One speculation may be related to the varying degrees of legal status in the United States. It may be possible that now that individuals have increased access to marijuana, they're just simply choosing to engage in a more frequent use or more daily use than they had before. So if we look at trends in drug use among young people, particularly from the ages of 18 to 25, so these are, your college-age students, we do see fairly high use of marijuana, fairly high engagement. So when we ask young adults, how many of you have smoked marijuana in the past month, we find it hovers right around 18%, between 18 and 20% answered yes to that question. This is in stark comparison to other drugs like cocaine or hallucinogens or psychotherapeutics, which is below 6%. We find 3 times more young adults engaging in the use of marijuana. So what are some of the effects, the physical effects, or the physical impact of marijuana use? The active ingredient in marijuana is THC. So when we think about it from a physiological perspective, the immediate impact is these bloodshot eyes, dry mouth, maybe itchy eyes. We speculate that might happen because it might actually be almost like a hay fever reaction. I mean, it is a plant, just like having allergies. Dry mouth and throat, increased appetite, but it also does things like reduces pressure within the eye, increases blood pressure, and then it does create damage to the lung structure and function, particularly in long-term users. Remember, you're dragging, inhaling, and holding, and that does cause damage to the lungs. From a psychological perspective, the THC seems to create feelings of relaxation, sociability. Smoking marijuana does interfere, however, with attention, memory, thinking. People that smoke heavily or smoke for a long period of time, we do see a gradual decline in IQ. Very heavy doses can induce hallucinations and panic. Some people have very bad reactions to smoking marijuana, and it's almost like a panic attack, or they come to believe that someone's out to get them, or the people that they're with are trying to hurt them, and they become very panicked and agitated. Part of the challenge is that it's very difficult to regulate dosage. So the full effect of marijuana can take up to 30 minutes to appear. And so what happens is often people smoke more than what they had intended, waiting for the impact or the effect to kick in. We know it also interferes with cognitive functioning, impairs memory, it impairs complex motor skills. So research has identified 2 brain receptors, CB1 and CB2. These receptors are found throughout the body, but we have a high concentration in the hippocampus. And the hippocampus, that's the center for learning and memory. And this may be why smoking marijuana is connected to cognitive problems, some of the cognitive problems that we see with marijuana use. The sort of inability to utilize short-term memory or engage cognitively. while smoking marijuana. What a PT scan told us is, showed us when studied utilizing PET scans, discovered increased blood flow to the emotional regions, which include the amygdala and the anterior cingulate. Now, I want to remind you the amygdala is responsible for emotional memories, particularly anger, fear, those sorts of emotions. At the same time, you're getting decreased blood flow to the temporal regions. The temporal regions, which are on the side of the brain, those are responsible for hearing. And that might explain some of the attention deficits that we see, that the person just simply either can't hear or can't process what they're hearing as well. Students always ask me, is marijuana addictive? Well, that depends. The research that's been done isn't clear. We do know that if a person is a habitual user, it can lead to tolerance. In other words, they need to smoke more in order to get the effect or the impact that they're looking for. And we do know, research has shown us that withdrawal symptoms have been observed in people that have chosen to stop smoking marijuana cold turkey. But again, the jury is sort of still out on this as to whether or not we consider marijuana to be addictive per se. I don't want to leave our discussion on marijuana without talking a little bit about its therapeutic effects. There's a number of therapeutic effects, a number of therapeutic uses for marijuana that have been documented for years, really since the 70s. And research that's been done by very reputable organizations that have looked at, can marijuana be used with positive clinical results. And there is quite a bit of research that has documented that it does reduce nausea and loss of appetite that can be caused by debilitating syndromes and terminal illnesses. So things like chemotherapy, relieving discomfort from AIDS, chronic pain syndromes. Yet, despite these findings, I want to be clear, according to the Supreme Court, federal law prohibits dispensing marijuana for any reason, even for medicinal purposes. Even though 22 states right now allow the medical use of marijuana, and there are other states that allow its recreational use, as far as the federal government is concerned, that is prohibited, even if the state approves.